Hypertensive emergency, acute symptomatic hypertension with or cardiac and other organ damage, renal, cardiac, retinal, and the brain. These are the four main organs. Damage is important cause of human morbidity and mortality because they have acute kidney injury. In the long term, they can have chronic kidney disease and neurological disease in impairment like stress and stroke and encephalopathy. Then cardiac involvement, cardiomyopathy, congestive cardiac failure, and retinal damage, visual impairment, all are possible. They are our concern. When you do not have an organ damage, but you have a raised BP, you have a hypertensive urgency. When really this occur? When the BP is more than 30 millimeter mercury or above 95th centile or 20% above 95th centile, in adult, acute severe hypertension, you call it how much? It's 120 diastolic, 180 systolic. And even it is possible with lower pressure, like more than 140 systolic, more 90 millimeter mercury diastolic. So, in adolescents and in adult population, it fluctuates because of the activation of the RAS and other systems over here, sympathetic, your peptide regulation alteration, and few more things. Uh, when the BP is high, what happens? You have RAS activation, you have sodium excretion, natriuresis. Also, it occurs in the renal artery stenosis, renal artery stenosis. You have the angel elevation, neutrophil gelatinous lipase in activation, and you have hyponatremic hypertensive syndrome and few more other changes in the kidney and throughout the all systems. So reduce this BP, dangerous BP, 25 to 33%, one fourth to one third by 8 hours. So usually by IV medications, nitroprusside, nitroglycerin, labetalol, and your nifedipine, nicardipine, and istradipine. They are the drugs used. At times you can use orally, nifedipine orally, Dalat capsule used once upon a time. Still, it is in practice throughout the globe, but use in appropriate dose. Do not go for precipitous fall blood pressure because if you do that, you will be breaking the autoregulation. There can be organ damage and organ loss. And so, hydrolazine also can be used. Clonidipine and clonidine and phentolamine can be used. The enalaprate and the captopril can be used. Captopril you can use also orally, but if his patient is unconscious, don't try that. And esmolol and the minoxidil, urapidil, and finally IV fusimide. They are the medications 14 or 15 something recommended globally. I use globally. That can be used safely and reduce BP by 8 hours, one third and one fourth. Rest two third or something you do by 1 to 2 days. Don't go for jumping. At the same time, don't take risk of the life. It's essential because most of the people die over here, and commonest cause of death globally is the cardiovascular effect of hypertension.